I have always loved working in my garden, but as I've gotten older, that's really hard to do because the pain I have in my hands, in particular in the joint here. It's called thumb arthritis, and it's really pretty common. About a third of the women over 50 have it, and 50% of the women over 70 have it. But there are some things you can do to alleviate the pain.
Pain at the base of the thumb is an extremely common complaint. Typically happens more in women than men, about a 4-to-1 ratio. Arthritis in this joint, and really it's the nature of the joint. It's a very mobile joint. It lets us position our hand and our thumb in all different sorts of planes, but that instability can also lead to some wear and tear in that joint. And when the joint wears out, boy, it's really uncomfortable. Everything when you're gripping, trying to get your hands around glasses, pinching tight things, opening jars, keys, things like that, it's really uncomfortable. So what I try to tell people is the first thing to do, just like everything else, is modify those activities that bother you. If you can't get around it, there are braces that are available to sort of put the thumb in a different position and give you a bit of support. If those sorts of things aren't working, then we think about injections to buy you some time to alleviate symptoms. And some people get by with non-operative treatment forever and ever. There's nothing that ever obligates someone to have a surgery for this, but there's certainly very good surgical options to treat arthritis at the base of the thumb. The most important thing for surgery for arthritis at the base of the thumb is to remove one of the two bones that is involved in arthritis. It's been demonstrated for well over 30 years that that's the most important thing. There are many variations on what to do after you get that bone out to further stabilize the thumb. The recovery from it, at least in my hands, is about 6 weeks in a cast. And I tell people they can expect a year of improvement. Okay, so this isn't something you wake up the next day and you feel great. You're pretty sore for a while, but you're making steady progress after you get out of that cast to regain your motion and regain your strength. And I always tell people the reason to have surgery for arthritis at the base of the thumb is not to improve how the hand looks, not to improve how the strength of the hand is or how you function, is to eliminate pain. And that's absolutely the biggest reason.
So when all else fails, that would be the go-to option.
That's right.
Everything else.
Very successful. Probably more than 85–90% of people are very happy they had that surgery.